Good evening and welcome to Over the Counter, a half-hour show that focuses on health. My name is Monique Hammond and tonight we will be talking about steroids. We will actually be talking about two types of steroids. First of all, we'll talk about the adrenocorticosteroids, or I would like to call them the anti-inflammatory steroids. And this is mostly the capacity that I would like to focus on, the anti-inflammatory properties of these compounds. And then we'll also be talking about the anabolic steroids. Now these are the muscle man steroids that have been abused quite a bit in the sports and in the bodybuilding worlds. And we shall see now how these compounds that are so different in their actions in the body actually have something in common, because they are called steroids because they share together one common parent or skeleton structure, or at least a good portion of their structure in chemistry as we call it, and that is called the sterol molecule. And I don't do this very often, and I'm certainly no chemistry teacher, and I'm also not a very good artist, but I drew this up, this basic skeleton steroid structure that these compounds all share in common, because I kind of think it's interesting. Chemistry sometimes becomes like people. We have so much in common and yet we are so terribly different. So let's take a look at this now for a minute. Now the basic kind of chemical structure that I have been talking about looks something like a honeycomb structure almost. And it is shared by all the compounds that we call steroids, whether it is anabolic steroids or whether they are adrenocorticosteroids. But now let's return to our adrenocorticosteroids, or the steroids that we will be talking about mostly in their capacity as anti-inflammatory steroids. Now they kind of are all around us all day long because the body naturally makes them. They are made in the adrenal glands, and the adrenal glands, of course, you remember, are those little glands that sit on top of the kidneys. And they are made specifically in the adrenal cortex. And the cortex is just a very fancy name for saying in the outer layers of the tissue that surrounds the adrenal gland. And so that's where we get the name adrenocorticosteroids from. So the body then naturally makes these, cortisone and hydrocortisone, because without it the body cannot function. Now the adrenocorticosteroids are also not only found within our bodies, but we also find them everywhere on the pharmacy shelves. In the over-the-counter sections, for instance, there we find the ointments and the creams that contain hydrocortisone. And hydrocortisone is mostly put on rashes on our skin, such as poison ivy, or anytime we have any kind of an allergic reaction. It takes the itching away and it takes the burning and the red-hot feeling away. Then these adrenocorticosteroids can also be used to replace cortisone or hydrocortisone or steroids to the body that might not be making enough of it or that might not be making any. Because some people have lost the function of their adrenal glands, or some people even had them removed surgically because of some problem. The adrenocorticosteroids are also used in order to prevent organ transplant rejection. Now we also have other medications available nowadays that prevent organ transplant rejection. However, the steroids are still very much in the picture. The adrenocorticosteroids are also used in chemotherapy combination for the treatment of certain cancers. So they are used for a lot of things, and believe me, they are very, very potent medications. Now what I am going to be limiting myself to is, first of all, to talk about them in sort of a general fashion, and mostly as we all kind of get to know them at some point or other in our lives with their anti-inflammatory properties. And I'm also only going to be talking about the pills, the tablets, the capsules, or the oral dosage forms as we call it in the business, because that's the ones that we as patients are mostly running up against. Now in the hospital, of course, we also take these steroids and we put them in an IV bag, or we inject them into patients with a syringe into the muscle. But we're not going to be talking about those different types of treatments. We'll just be talking about our pills and so forth. We're also not going to be talking about the inhalers, for instance, that the asthmatic people use sometimes, because asthma people sometimes have trouble breathing because they get such an inflammatory reaction, as we call it, in their lungs. And they have inhalers where they can inhale the adrenocorticosteroid directly into the lung. We will be talking in a different segment about these inhalers specifically. And so that's when we will be covering all sorts of things regarding these inhalers, including the steroid inhalers. Now, when it comes in medicine to combating inflammation, then usually the doctor has tried already aspirin or some of the non-steroidal anti-inflammatory medications that we have talked about in another show. And these non-steroidal anti-inflammatories were, remember, the non-prescription over-the-counter strength ibuprofen, or the prescription strength Motrin, Naproxen, Indocin, Voltaren, any of those. Also including the aspirin. We must not forget about aspirin when we're talking about anti-inflammatories. So anyway, the doctor probably has already tried some of these medications, and when we run up against some problems and these medications are not cutting it for us, then all of a sudden we are going to be adding to our regimen the big guns, the very big guns called the steroids. Now, so that we all kind of pull together and know what kind of medications we are talking about, let me give you some names. Besides the cortisone and the hydrocortisone, you might have heard of prednisone, Midrol. There is something out there called the Midrol dose pack, and many people have run up against that when they go into the emergency room and they have an active bruise or a flare-up of arthritis, or they have a very severe allergic reaction. The doctor might prescribe for them a Midrol dose pack. And then there is also Decadron. And I'm going to be writing these out for you with their generic names so that you can kind of see them, because the generic names are rather lengthy. And now let's just talk for a minute about the various names of the various medicines that we call adrenocorticosteroids out there. I'm going to try to give you some names, the generic name and the trade name and so forth. And of course I can't give you all the names because these medications are made by a lot of manufacturers. There are a lot of different products out there, but I'll give you the ones that are maybe the most frequent ones. And remember, I'm not advertising anything here. I'm just trying to give you an idea so that we all know what we are talking about, because that's extremely important. Now, first of all, there is cortisone. And one of the trade names that we are finding cortisone under is Cortone. Not a terrific difference. Then there is dexamethasone. Dexamethasone is also manufactured as Decadron or Hexadrol. Hydrocortisone is manufactured as Cortef. Methylprednisolone, manufactured under the trade name Midrol. Prednisone, manufactured under the trade name of Deltazone and Orozone. And then triamcinolone, which is manufactured as Aristocort or Kinacort. And of course, these are only a few of them. There is a long list out there. These are probably the most frequently used medications and the ones that we see commonly used for prescriptions for patients to take home. Now, when we are put by our physician onto these medications, then we have to follow instructions very carefully. Now, the dosage that is used in order to get an anti-inflammatory kind of reaction out of these medications is usually higher than the dose that we use when we just try to replace steroids to the body because of the body's inability to make these steroids by itself. Now, for the anti-inflammatory purposes, usually the treatment is short time. It can be days, it can be just weeks, and at also higher doses, as I mentioned before, and it should be discontinued as soon as we can just possibly afford it, because these are very potent medicines. Now, there are some people who are being treated for different conditions with these medications, and so the length of the treatment and the dose of the treatment depends on what we are treating, whom we are treating, how much we have to treat, and so forth, on the condition of the patient, in other words. Because some people are on it for months, some sometimes for their lifetime. And so it's all different, it all depends on the case. But no matter what, the person who decides when we stop taking these medications is the doctor. Please do not ever stop taking these medicines without consulting the doctor first. Now, you might be reading in magazines and so forth about side effects with steroids. You might also hear some very nasty things from neighbors who tell you all sorts of experiences. If it is your body, check it out first. And I tell you why. Because depending on how long you have been on a steroid, such as prednisone or hydrocortisone or any of the above, and depending how much of a dose you have been taking, you need to be tapered off. Okay? The doctor is going to give you specific instructions how you should be getting yourself off. And when you're having a lower dose or you don't take it for as long a time, sometimes you do not need to taper off. But don't make that decision. Don't take a guess. Ask first. Now, why do we have to taper? Okay. Let's do a little Mr. Rogers experience here, and let's just say, let us pretend that we are an adrenal gland. Okay, fine. So I'm an adrenal gland, and I'm producing steroids for a body, and I'm busy at work all day long. And now here all of a sudden I see that my territory is getting invaded from the outside with steroids that I didn't make, but that the body seems to be getting along fine with them. And so I say then, well, in that case, maybe I can work a little less, and maybe I can just take a little snooze and go to sleep for a while, because the body seems to be doing fine on what is happening. So now, what happens if the person who puts these steroids into its body by means of a prescription drug, all of a sudden, suddenly, bingo, stops taking this? Now we do not have any steroids on board, because remember, the adrenal gland kind of went for a little slumber party. And we also remember that the body cannot get along without any steroids, such as cortisone and hydrocortisone or the like. So what we are ending up now with is an adrenal steroid crisis. And we call that a steroid crisis because that's what it is. It is a crisis. It is a life-threatening situation. So never stop taking these medicines without consulting your physician. The tapering then is like a gradually waking up the adrenal glands again, so that by the time we are not taking our prescription anymore, the adrenal gland will be there manufacturing the steroid again for the body to function with. And that's the importance of the tapering process. Now, when you're bringing a prescription like that to your pharmacist, they always get that sinking feeling. And everybody kind of goes, oh my goodness, there is a Decadron taper. Because they are kind of messy to fill. First of all, the patient sometimes ends up with about 20 or 30 pills in the bottom of a prescription vial that is this large, and where the label sometimes reads like a newspaper, because there is a lot of information on those labels. And so the label might say something like this: take 4 tablets once a day for 3 days, then take 3 tablets once a day for 3 days, and so forth. There might be specific instructions. And sometimes the patients say, well, why do I have to take 4 tablets? My goodness, that's all I'm having for breakfast, you know. There's so many tablets, don't you have it in a stronger dose? And yes, we do. But you can see that it becomes very inaccurate if we are telling you, well, then you half your tablet, then you got to cut it in 4th and then into 8th and all that kind of stuff. It becomes very messy, very inaccurate, and a lot of potential for mistakes. So that's why it is easier to have smaller amounts and then to decrease gradually by 1 tablet, another tablet, and so forth. So that's the tapering process. And whenever you get a tapering process like that, the pharmacist usually comes out, and now more than ever, because we have to talk more to patients, and will explain to you and read the label with you and make sure that you understand. And if you have any question whatsoever, call the pharmacist or call the doctor and ask about it before you make a mistake. And now let's talk about a few side effects with these medications. First of all, when we're talking about side effects, I can't say it often enough. I can only talk about those side effects that are general side effects, that are side effects that the patient can catch on to easily and maybe report to the doctor so that we can stay safe and we can take our medications with a minimum of aggravation. And we're also talking about not all the side effects, of course, because that is impossible. Because these medications in particular have a lot of side effects, and especially depending on what the dose is and what the length of treatment is. Short term, when we are treating for a couple of days, maybe a week or so, we usually don't have too many problems. And the problems seem to be limited to the problems with the stomach. First of all, they can upset the stomach, and second of all, they can also, like other medications that take away the inflammation in the body, they can also cause ulcers. And so the side effects are mostly, for our purposes, kind of limited to the stomach. However, you're instructed to take these medicines probably with food, and if you take them once a day, like it is usually done, then take them in the morning and take them with breakfast. The morning is a better time because that's normally when the body starts pumping the steroids. And so it kind of coincides a little bit more with the body rhythm. And also some people report that steroids kind of pep them up a little bit. So that if you take them too late during the day, you might, get a little bit more anxious or nervous or have more trouble sleeping. Because that's one of the natural side effects of the drug. Now, adrenocorticosteroids, or hydrocortisone and its derivatives, also decrease the body's natural response to infection. They decrease the immune response. And it is actually in that capacity that they are used to decrease the rejection of transplants, as we talked about earlier. But if you are on these medications, then watch for signs of infection, anything that might tell you in the body that you might have an infection, such as you get a fever, you have a sore throat, you have trouble or pain on urinating, and so forth. And report these to your doctor, because your body is going to be somewhat suppressed by the medication that you're taking, and so might not react to this infection in the way that it should. And so you have to call your doctor on that. If you're taking these medicines for a long time, as I mentioned before, that's when we usually see more of these side effects popping up. Now, something that steroids do also in a natural way, because that's the way they act in the body and that's part of their chemistry, they cause water retention. And in people with high blood pressure, of course, that is very counterproductive. So if you're a person who is taking high blood pressure pills and so forth, then make sure that while you're taking these steroids that you go in for blood pressure checks and that you keep track of this. And as a matter of fact, when you're taking these steroids, it's not unusual for the doctor then, of course, to tell you to limit your salt intake, not to eat so much salt, because salt, again, retains all the more the water. And then the doctor might also tell you to eat a little bit more potassium. Sometimes doctors give people some prescriptions for some potassium pills that they take along with these things, and sometimes they just tell them to eat maybe a few more bananas or figs, raisins, cantaloupe, anything that is high in potassium. Because along with the salt and water retention, the body also starts to waste the potassium when we are taking steroids. So that's a little bit difficult to understand, but take it in stride and talk to your doctor about these things, and I'm sure you're going to get instructions. Also, these medicines can waste calcium in the body, so that the body loses calcium faster. And so discuss this with your doctor if you're already taking extra calcium for osteoporosis, or if you have already some bone disease, because they are going to have to start looking after that for you. And call your doctor if all of a sudden, you never had this problem before, but all of a sudden you kind of get pains in your hip, in your bones, in your ribs, and so forth. And that might indicate that you're losing calcium off your bones. And so call your doctor and talk to him about that. Then we have to address the diabetics once more. You have to monitor yourself carefully while you're on adrenocorticosteroids, such as hydrocortisone and prednisone and the like, because you might see a rise in your blood sugar. And so you need to be monitored very carefully while you're taking these medications. Call your doctor if you have problems with your vision, such as a decrease in vision or blurred vision, because steroids can increase the pressure in the eye. And so careful with glaucoma. And so talk to your doctor about it if you have any kind of a problem with vision. Now, as I mentioned before, these are only a few of the side effects that you can experience with long-term high-dose use of these steroids. And as a matter of fact, you should remember that let everybody that you see, any doctor that you see, be that a dentist, an eye doctor, any kind of a doctor that you see, let them know if you're taking adrenocorticosteroid by prescription, if you're taking prednisone or Decadron or Midorol or whatever it is. It's very important that everybody knows who treats you that you're on this type of medication, because there are special precautions that have to be taken. And now let's take a minute and talk about the anabolic steroids. And these are the muscle man hormones that are so abused in sports and also in the bodybuilding world, and because of that have had some bad press. Now these steroids again come from the same parent molecule, the sterol, but they are related mostly to male sex hormones. And we could say that the father of all anabolic steroids is testosterone, the male sex hormone. Now, the anabolic steroids are used in medicine for certain types of low male sex hormone production, such as in young boys that do not develop very well. And they have also been used in certain types of breast cancer in the past, but everything only under the very strictest medical supervision, and I cannot stress that enough, because the indiscriminate and abusive use of these things leads to a lot of long-term and very serious side effects. And I'm going to read them off to you because there are many side effects and they are serious, and I think it is important that we point them out. So the indiscriminate abuse leads to impotence, high blood pressure, liver tumors, change in sexual drive, mood swings and irritability, stunted growth in adolescence, and baldness. Now women, and it's not only men who abuse these things, women are also a part of the picture. In women there we see changes in the hair growth pattern, we see deepening of the voice, and let's call it an overall manly and virile appearance. Now, despite all of the bad press that anabolic steroids or muscle man steroids have gotten out there are still some sports participants that have not heard the word nor seen the light. A Pennsylvania State University study tells us that almost 15% of male college athletes freely admit to using anabolic steroids. And of course, women also abuse these things. Athletes involved in sports requiring short power bursts, such as weightlifting or sprinting, are particularly prone to using anabolic steroids. And despite massive education programs, there are still always out there who are holding out the hope that the use of anabolic steroids will increase their performance in competition. Now, winning is a thrill, particularly if we win through our own efforts, but winning with the help of anabolic steroids is almost like making a pact with the devil. Because no matter how smart we think we are, trying to fool the system and trying to elude the testing, no matter how smart we think that we are by devising creative ways of dosing the stuff, in the end the price will be very high. And being thrown off the team is only the least thing that can happen to those people that are chronic anabolic steroid abusers, because they are going to end up paying with their health. And now let me take a few moments to talk about the so-called anabolic steroid substitutes, or simply steroid substitutes. Again, these things are used in the athletic world and in the bodybuilding world, and all of those people who want to beef up their muscles, in short. And you might remember that in the Olympic Games of 1992, there were several athletes who were banned from participating in the games, even though they did not, amazingly, they did not directly test positive for anabolic steroids, but they tested positive for other banned drugs. Now, what were those banned drugs? First of all, there is a compound called clenbuterol. And this is a veterinary drug that is used in some European countries in order to beef up the muscle or build up the muscle mass of exhibition livestock. It is not approved for any use in the United States. Now, clenbuterol has made people sick from just eating meat that contained traces of the drug. And the symptoms included a fast heart rate, nausea and tremors, and so forth. Veterinary drugs are often used as steroid substitutes because they are easier to obtain than drugs made for humans. Then there is another compound being peddled in the locker rooms and in the spas and advertised in bodybuilding magazines, and this is the so-called GHB, or gamma-hydroxybutyric acid. This is a pretty dangerous drug, actually. It is touted to be stimulating growth hormone, and this has made many people good and sick, with slow heartbeat, decreased blood pressure, seizure-like movements, vomiting, and difficulty breathing. And the symptoms from GHB can appear between 15 and 60 minutes after taking the drug. Some people have been brought into hospital emergency rooms, actually in an acute coma. And then that brings us to the actual human growth hormone. Now, human growth hormone is used in medicine, and it is used in children whose pituitary gland is not functioning very well and who fail to thrive and to develop. They do not grow enough, they do not grow fast enough for their age, and so forth. Again, human growth hormone is used under very strict medical supervision. Some athletes believe that growth hormone strengthens and beefs up their muscles, but research has not really confirmed this. Athletes, however, who abuse growth hormone do so mostly because it is undetectable in drug tests. Too much growth hormone, however, results in heart disease eventually, and in a lot of other metabolic conditions and problems. Many problems with substances of abuse, such as these, result from the fact that the people who are actually abusing them use too much of it, they use it too frequently, too high a dose, they don't even follow the instructions that come with the stuff. Now, in May of 1992, there was a gentleman who died who used to play for the LA Raiders, and his name was Lyle Alzado. He had a rare form of brain cancer, if I remember well, and he openly stated that his condition and his plight was solely due to his long-term abuse of growth hormone and of anabolic steroids. And of course the list of the abused chemicals and substances grows, and when we get rid of one, or we have gotten, the people discouraged from using one, then another one props up, and so it goes. But we all live in a free country and we all make choices. And with those choices come responsibilities and there come consequences. And these are just some of the consequences that chronic abusers of these substances have to bear. Because not only do they pay with money for buying this stuff, but they also are going to be paying very high penalties with their life and with their health. And with that, we have come to the end of our show. And again, I thank you so terribly much for watching. I had really a good time being here, and I'll see you 2 weeks from now. And I tell you again, stay safe, stay healthy. This is Monique Hammond saying good night.